Hi, my name is Raquel McGuire, and I am going to be a doctor either in emergency medicine or primary care, so a physician of some sort, either a physician assistant or MD or DO. I did pick 5 indicators, so I did want to screen share my presentation only for information to you guys. Obviously, there's a lot that I would talk about, and I keep re-recording, so here's for 3 minutes. I wanted to talk about mental health as one of my indicators. I've chose this because I feel like Idaho is failing the community for mental health. We don't have that many programs. We don't have that many outreach programs, and I feel that in our society this has become a really big issue. It is definitely new to the medical field as far as being considered a disease, and there's definitely tools and educating that physicians can do for patients, as well as chemically balancing or not chemically balancing certain people. I went into the specific statistics for the nation, and suicide has increased by 1.3% for the nation, and adolescent depression episodes have increased by 2.4% from 2008 to 2013. I think it's super disappointing when we look at Idaho's. Excuse me, increase was from 10.2%, which was really close to our goal, which was about 7%, to 23.2%. So we have over doubled our increase of suicide rates in Idaho alone. I mean, this is sad. It's really, really sad that we have increased that much. We don't have enough programs out there. We don't have enough education on how to deal with certain scenarios. And frankly, I don't feel like people even understand what mental health really is and the different aspects medically that we can help. There was a 14.4% increase over the years for adolescent depression, another thing that I don't feel like we educate well enough. There's so many variables out there that contribute to adolescent depression and suicide rates. One of them might be what they have at their fingertips, internet, social media, all of that. A second indicator that I would like to talk about is clinical preventative services and kind of access to health care. They kind of coincide with my idea of why I will be seeing this and be able to make a difference as a provider in this field. I chose both of those because I feel like physicians should give back to their community, not only through free screenings once a year or wellness visits once a year, but maybe even a uninsured once a month care, whether it be just take a look at someone's teeth or just give them a physical, do a screening for cancer, there's programs out here that help with that, but it's very hard to get into. They're flooded with people, and unfortunately our insurance rate is not 100%, so there are people out there that are not getting screenings and not getting checkups and not going to the doctor until they're really close to the end of their due date, or going one time and then having a baby and complications occur. So there's a lot of links here, but my main goal as a physician is to give back to my community, travel to rural areas, educating. All of these are super important to me, and I feel like they're going to be a big part of my job, especially policy change and advocating for the patient. Is definitely something that I think physicians should do. I'm just going to concentrate on clinical preventative services. In 2008 to 2013, there was we improved by 6.1% nationwide, but still 10%, over 10% away from the goal nationwide. And screenings, I'm just going to say screenings for cancer death rates is a statistic that I found that kind of overlaps with the idea of screenings because their cancer is being caught earlier. So that actually lowered and was better than the desired goal. There's other statistics here that you can look at, but thank you so much for watching my presentation, and just remember that any job in the healthcare profession will make a change. Thanks.